Or you still do them? Ready? Good morning. Today is Tuesday, April 1st, 2025, times 9 a.m. We're now going to start the Board of Commissioners' regular board meeting. Please stand and do the Pledge of Allegiance with me.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Just a heads up, we were informed that the board needs to do a better job of speaking into their microphones, as I am doing now for the first time in quite a while. Anyway, just wanted to make sure everybody understood who was here today. All commissioners are present, along with our auditor, treasurer, and our county coordinator. Not in attendance, it would be our attorney at this point. Okay. Are there any amendments to the agenda? Okay, then can we get a motion to approve the agenda as is?
So move to
Thank
approve
you.
the agenda.
And a second?
Second.
Nice job on the microphone, Tim. All in favor?
Aye.
All opposed? Ayes have it. Okay. Denise, would you do the consent items, please?
Consent items today are the meeting minute approval for March 18th, 2025. American Legion 417 Oscar Jacobson Post, a one-day temporary on-sale liquor license. The event date will be 7/12/25. And American Legion 417 Oscar Jacobson Post, a one-day dance license, and that event is 7/12/2025.
3 consent items in front of us. I would need a motion to approve those, please.
So move.
Thank you. And a second?
Second.
Second, and thank you. Any discussion? Hearing no discussion, all in favor?
Aye.
Opposed? Ayes have it.
First item I have today is to approve the commissioner warrants. Background is sent for your review. Recommendation is to approve the commissioner warrants with an ACH and a manual payment totaling the amount of $79,268.60.
We have the commissioner warrants in front of us. We would need a motion to approve that.
So moved.
Thank you. Moved by Mr. Denny. Second?
I'll second.
Thank you, Mrs. Commissioner Becker. Any discussion? Hearing no discussion, all in favor?
No, roll call.
Oh, yes, excuse me. I even wrote that note here. Roll call.
Commissioner Denny?
Yes.
Commissioner Becker?
Yes.
Commissioner Newman?
Aye.
Commissioner Naska?
Yes.
Commissioner Byers?
Yes.
Okay, next item I have then is the Health and Human Service Commissioner warrants. Background is sent for your review. Recommendation is to approve the Health and Human Service Commissioner warrants with an ACH and a manual payment totaling the amount of $63,079.73.
Thank you. Can I get a motion for the Health and Human Services Commissioner warrants?
So moved.
Thank you, Commissioner Newman. Is there a second?
Second.
All right, you get that? Commissioner Denny seconded. Any discussion? Hearing no discussion, we'll take a roll call vote.
Commissioner Newman?
Yes.
Commissioner Denny?
Yes.
Commissioner Becker?
Yes.
Commissioner Naska?
Yes.
Commissioner Byers?
Yes.
And the last item I have then would be the Health and Human Service SSIS warrants. Background is sent for review. Recommendation is to approve the Health and Human Service SSIS warrants with an ACH and a manual payment totaling the amount of $87,176.19.
Excuse me. Before us is the Health and Human Services SSIS warrants. We need a motion to approve this.
I'll make that motion.
Thank you, Commissioner Noska. A second?
Second.
Commissioner Becker seconds. Any discussion? Hearing no discussion, we'll have a roll call vote.
Commissioner Naska?
Yes.
Commissioner Becker?
Yes.
Commissioner Denny?
Yes.
Commissioner Newman?
Yes.
Commissioner Byers?
Yes.
Thank you.
Thank you. Item number 6 today is Hands of Hope Resource Center. I see we have our staff here. Thank you. Come on up. Are your mics turned on?
Push the green.
Push it.
Red
Should be green, I believe. We're all working on our microphone etiquette today, so. Morning, Barb.
Good morning. We're here today to present two proclamations. The first one is for April, which is Sexual Assault Awareness Month. And then the week of April 6th through the 12th is National Crime Victim Rights Week. So I will start with the sexual assault. Okay. Oops. I'm sorry, I grabbed the wrong one. We'll start with, with National Crime Victim Rights Week.
Okay. Whereas Americans are the victims of more than 20 million crimes each year, affecting not only individuals, but their communities too. And whereas many victims face barriers such as isolation, distrust of authorities, language limitations, lack of transportation, or cultural barriers that keep them from accessing the services and criminal justice systems that can help them recover from crime. And whereas dedicated victim services providers work every day to meet the needs of crime victims, yet there are still too many victims without meaningful access to rights and services. And whereas Crime Victims' Rights Acts passed here in Minnesota and at the federal level have provided crime victims with ways to participate meaningfully throughout the criminal justice process. And whereas the rights of crime victims are best protected when all participants in the criminal justice process, not only victims, are properly educated about victims' rights. And whereas we must respond to crime and violence by helping victims access the justice, assistance, and support they need to rebuild their lives and provide a sense of hope for their future. And whereas Hands of Hope Resource Center is hereby dedicated and committed to ensuring that accessible, appropriate, and trauma-informed services are offered to all victims of crime. Now therefore be it resolved, the Todd County Board of Commissioners do hereby proclaim the week April 6th through April 12th, 2025 as Crime Victims' Rights Week, reaffirming Todd County's commitment to creating a victim service and criminal justice response to all victims of crime so that they may find relevant assistance, support, justice, and peace.
Thank you very much. I'd like to get a motion to approve this proclamation, please.
Mr. Chair, I'd like to make that motion to approve.
Thank you, Commissioner Denny. Is there a second?
Second.
3 seconds. Go ahead, pick one. Razan. Any discussion? Hearing no discussion, all those in favor?
Aye.
Opposed? It is proclaimed. Thank you. Good job.
Okay, now I have the right papers, so. Sexual Assault Awareness Month, April 2025. Whereas April marks Sexual Assault Awareness Month, also known as SAAM, a time to bring attention to the widespread issue of sexual violence and empower communities to take action. This year's theme, Together We Act, United We Change, highlights the power of working together to create safer, more respectful environments for all. And whereas sexual abuse, assault, and harassment affect individuals of every background. To address this, we must promote education around consent, healthy communication, and bystander intervention. By equipping individuals and communities with these tools, we can help prevent violence before it starts and foster a culture of respect and care. And whereas central to this campaign is the importance of amplifying the voices of survivors, especially those most vulnerable in our communities. Their experiences must be heard and acknowledged, and their stories should guide our efforts to combat sexual violence in all its form. And now, therefore, be it resolved, everyone in our communities deserves to live in safe and supportive environments where they are treated with respect. When our workplaces, schools, and communities work together to uphold safety and respect, we make progress in preventing sexual abuse, assault, and harassment. Be it further resolved that the Todd County Board of Commissioners does hereby proclaim April 2025 Sexual Assault Awareness Month and calls on all individuals, communities, and organizations of Todd County to take action to prevent sexual violence. Each day of the year is an opportunity to create change for the future. Thank you.
I would need I need a motion to accept this proclamation for.
I'll make the motion to accept.
Thank you, Commissioner Noska. Is there a second?
Second.
Thank you, Commissioner Becker. Any discussion?
Other than thank you for what you guys are doing
Right.
out there.
Absolutely.
Hearing no discussion, all in favor?
Aye.
Aye.
Opposed? Ayes have it. Thank you for your continued work. Amazing. We really appreciate it.
Mr. Chair, but
Thank you.
You guys want to talk for a quick second about the raffle coming up? And I have tickets available that are in the office yet. I will pick up today, so if you need a raffle ticket.
She's
Oh, thank you. She's got them. Do you want to just take a second and talk about it?
Sure. So this is our 4th annual Denim Day raffle, which will take place on April 30th. Proceeds are going to go to support victim services in ways that our grants don't always cover. So it's the one fundraiser that we do each year besides our annual mailing. Tickets are $20 each. There are only 500 sold, and please consider supporting our agency. So.
Perfect. Thank you.
Thanks again.
I'll grab them.
Please, yeah, we'd love to do that. You going down for lower?
We were down below last time, weren't we?
Yeah, I think it's best.
Well, this is theirs, so I'll try this. Are we, Barb, can you move in? Which Barb? We got 2 Barbs. Are we centered on the, do you wanna raise that? I can't, because it's already out. No. Okay. Oh, yeah. Commissioner Barb, can you step forward just a little bit? No, not that far. A little bit. And the other Barb, just kind of scoot behind her a little bit. Move that way, though. All of you need to shift that way a little bit. Okay. Keep going. You gotta shift over. There, right there. There you go. Thank you for bringing that to my attention. Ready? All right. Here we go. Say cheese. Thank you. All right. I'll need all of your names too for the paper. Jackie can use those. Okay. Thank you guys. I took a couple and then she's gonna send me some of the ones. I'll send them to you, yeah. Yeah, and then go back, it's $15, right?
Here's mine, Tim. I'm
You
in.
know the order you were standing, that would be really hard.
Pick a lucky one.
I will, number 46, lucky number 46 on top.
Here we go.
Oh, look at this. Thank
There you
you.
go.
What are we buying?
46,
The
I'm taking
raffle
46.
Oh, you want to take it?
I might have to buy one.
Tiffany, for your wisdom.
Oh, you got that first one. We can fill it out afterwards here. If you want to fill it out now, I don't care. It's
I
fine.
don't think we got anybody coming up right now, so.
3 or 4.
Thank you.
Ready?
I never sign up for.
Okay, so we are
Someplace my place.
back, ready for business. Agenda item 7, looks like it's gonna have to be pushed to later on in the agenda or moved. We'll see what happens. But looks like agenda item number 8, solid waste, has arrived. Do we need to wait for anyone else? Great.
Good morning.
Morning, Mike.
Okay, the first topic on our agenda for this morning is the CAP grant change order. Number 1. Background is change order number 1 covers the first 4 changes to high-tech contract that were discussed within work session on March 18th on 2025. That the attached is the memo summarizing these costs. The total cost for the change orders is $120,182.74. The options are to authorize the solid waste director to sign the change order, or the option is to deny the permission to sign this change order. This is a budget item using contingency funds and CAP grant project monies.
All right, thank you. We have going up for motion, the CAP grant change order CO-1, the amount of $120,182.74. We would need a motion to authorize this.
Mr. Chair, I'll make that motion to authorize it.
We have a motion by Commissioner Denny. Is there a second?
I'll second it.
Seconded by Commissioner Noska. Any discussion?
These are the same numbers we talked about at the work session, correct?
That is correct.
Any other discussion? Hearing no discussion, we will ask for a vote. All in favor?
Aye.
Opposed? Ayes have it.
Okay, the second item is a CAP grant change order number 2. Background is the change order number 2 covers the proposed change to the high-tech contract that was discussed at work session on March 18th, 2025. It is to install interior liner panels at the transfer station building. Attached is a memo summarizing these costs. It also includes an additional 1.5-inch conduit from the electrical room to each scale. The options are to authorize the solid waste director to sign the change order number 2 for high-tech for $65,595.89, or to deny the permission to sign this change order. It is our recommendation to authorize the solid waste director to sign the change order number 2 for $65,595.89. Again, this is a budgeted item using contingency fund for the CAP grant project.
Okay.
Mr. Chair,
Yep.
on one of them, it says 66,745.64, and on there it says 65,595.89.
Yes, the actual itemized quote that we received from High Tech was the lower number.
Okay, so that's the correct number.
Yep,
Okay.
they kind of gave us an estimate until we actually got the steel order pricing. That's where it came in at.
Okay, thank you.
I'll motion to approve the change order.
I'll second it.
Okay, any further discussion? We have a motion and a second, so more discussion at all, anyone? Hearing no discussion, those in favor, please signify by saying aye.
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 Opposed? Ayes have it. Accepted.
Okay, the third item we have in front of you today is the purchase of office furniture. Background on this agenda item is in support of the new office scale house for the transfer station facility. With assistance from the facilities and MIS departments, Innovative Office Solutions designed and prepared a proposal that will supply the facility with the necessary office furniture. The bid amount for this proposal is $29,062.91. This proposal was discussed at our committee level and at board work session on 3/18/2025. This bid does not include window treatments. The options are to go ahead and award the bid for $29,062.91 to Innovative Office Solutions, or to not award the bid proposal. It is our recommendation to award the bid to Innovative Office Solutions in the amount of $29,062.91. Again, this is a budget item through Fund 51, CAP grant, and ARPA dollars.
All right, we're looking to get a motion to purchase office furniture at the solid waste. We'll need a motion for that, please.
So moved.
Motion by Commissioner Becker,
Second.
seconded by Commissioner Denny. Any discussion? Hearing no discussion, all in favor?
Aye.
Aye.
Opposed? Ayes have it.
If I can have one add item to that, just to reach out to Mitch Johnson and Facilities. We are really working hard with them and using reuse purpose furniture that we existingly have on staff. So we are using some of the shelving that's coming out of the attorney's office that we're using in our facility storage room in the new office scale house. So we're being very diligent trying to use what we have existingly, just so you guys understand that we're really trying to keep these costs as much as we can, as low as we can. So we are anticipating using quite a bit of their old furniture, so that's going to work out really well.
Thank you.
Very good.
Okay, the fourth item I have in front of you is the purchase of the Bobcat L95 wheel loader. In support of the new transfer station opening in midsummer of 2025, the department solicited a bid through the state bid process for the purchase of the Bobcat L95 loader. This equipment is needed in the daily operations of the new facility. The purchase price for this equipment through FarmRide is $91,591.23, minus $15,500 for a trade in our S550 Bobcat. The total purchase price of this Bobcat L95 loader is $76,091.23. This purchase was reviewed at work session on 3/18/2025. The options are to approve the purchase of this Bobcat L95 loader or do not approve the purchase. Is our recommendation to award the bid to FarmRide Equipment for the L95 loader in the amount of $76,091.23. This is a budget item and using Enterprise Capital Equipment Purchase Fund.
So my office will correct that amount up in the recommendation because he does have it listed
Under
in
the
the
recommendation?
Yep, in the financial implications, it's listed
Thank you.
right.
All right, so the motion or the topic in front of us is the purchase of the Bobcat L95 wheel loader, which would be through the enterprise fund in the 2026 capital equipment purchase, which I believe we previously were working on the contingency fund, but we've moved it.
Yep.
That's right.
So is there anyone that would like to motion for this?
I'll make a motion.
Thank you. Commissioner Newman?
I'll second it.
And thank you for the second, Commissioner Noska. Any discussion?
If I may, Mr. Chair? The reason for that price change, when we first submitted the original bid, and we weren't sure what it was going to do, but because of the tariff increases, that's where that amount came from. So they had to add that on by the time we got the actual quote through farm rate. So that was the difference in the bid price.
And Mr. Chair, this does make a lot of sense on purchasing this piece of equipment because the Bobcats or the forklifts and all that won't be able to go across from building to building. So you're gonna go from the new building to the old building. You're gonna need something with tires.
Yep.
A little faster, quicker.
Yeah, and I had quite a bit of research and discussions with the highway department, with Mr. Fellbaum, and again with Mitch with facilities. We really want to take the time and effort, so when we purchase this piece, it's also used for snow removal, compost loading, and a lot of that stuff. I mean, our facility is going to spread out quite a bit, so there's going to be an extensive amount of more snow removal equipment needed for this, so that is a really big benefit with this purchase of equipment, and then we're combining two pieces into one, instead of buying another Bobcat and another forklift, which is about $130,000, so we're actually saving money this way, so.
Yep, thank you.
Perfect.
Impressive, thank you, very impressive.
All right, the last item we have in front of you is the STEP contract renewal.
Did we get a vote? I'm losing my. Right, so any further discussion? No, okay, well, let's take a vote. All in favor?
Aye.
Aye.
All opposed? You got it.
Okay, the last item we have in front of you today is the STEP contract renewal. Background is STEP clients perform recycle sorting duties at our material recovery facility. The department signs a new contract with STEP annually for their services. The cost increase is due to the Minnesota minimum wage requirements. Cost per year is approximately $150,000. The options are to sign the contract with STEP or do not approve the signing of the contract with STEP. It is our recommendation to approve the signing of the 2025 STEP services contract for $150,000. This is a budget item through Fund 51.
Denise, can you scroll, is it scrollable? Because, so this is not, this contract doesn't have to be reviewed by anybody? Legal?
No, no. I believe they did, when they originally started having the signed contract, it was kind of more of a verbal thing before my time, but they really haven't changed anything of the verbiage on it. you know, we could definitely look at Mr. Lindemann's office, maybe reviewing it, but it's a pretty straightforward, pretty minor contract.
I'm guessing it is. I just wanted to make sure that we did what we've done for all everyone else, but.
All right, well, I'll make a motion to approve this contract.
Well, we have a motion. Is there a second?
Yeah, I'll second it.
Seconded by Commissioner Denny. Any discussion?
Yeah, Commissioner Byers, if I may, I mean, this is great. I appreciate that we can utilize their services and we can, you know, it's a great partnership you have with STEP to have that opportunity to add that labor
Yeah.
force to
You bet.
your facility.
It's been a really good change for them. I know Mr. Denny and Mr. Newman come out and spend time with us on our facility, which is appreciated. But yeah, it's been a good game changer for us. We had one individual retire. I didn't realize that individual was 71 years old. So she retired in August of this year, of last year, I'm sorry. So we've been able to reduce some of our costs on labor costs. When I started, we were at that 150,000. The last 2 years, we're down to about 133 in labor costs. Last year was 136,000. And a lot of that was just streamlining our operations and also including that new baler, which really helped. But we really tried to be diligent in lowering their risk of injury up there. It's been a game changer for them, and they've been really exciting. So it's fun to work with them on an everyday basis. Yep.
Yeah,
So,
thanks, Mike, appreciate
yep,
it.
you bet.
Denise, will this have to be signed off by the chair or anybody then after we do this?
I do not.
Okay. Okay, so we have any other discussion? Well, let's take a vote. All in favor?
Aye.
Opposed? Ayes have it.
Thank you, gentlemen.
Thanks, Mike.
All right. Admin.
Okay, the 2025-2027 Teamsters Courthouse Employees Contract. The Todd County Negotiations Team met with the Teamsters Courthouse Employees Union representatives, and they successfully reached a tentative agreement. Key highlights of the agreement include the cost of the Minnesota paid family and medical leave premiums will be shared equally between the employer and employees, with the employee portion deducted through payroll. Employer contributions for dependent coverage will continue to increase in line with previous trends. In 2025, single insurance will remain fully covered for employees. Starting in 2026 and 2027, employees who choose the high-cost single plan will contribute $25 per month. A new 11-step salary schedule will take effect on the first full pay period in January 2025, with employees placed on the step in their grade that provides an increase plus one additional step. Costs of living adjustments, COLAs, are set as follows: 2.5% in 2025, 3.5% in 2026, and 3.0% in 2027. A cap on sick severance will be implemented for employees hired on or after January 1st of 2025. The board's options are to approve the Teamsters Courthouse Employees 2025-2027 union contract, or to not approve the Teamsters Courthouse Employees 2025-2027 union contract. And the recommendation would be to approve the contract.
Thank you. We have agenda item here, ahead of us, 2025-2027 Teamsters Courthouse Employees Contract. We would need a motion to approve that.
So moved.
I will make a motion for approval of the contract.
Motion made by Commissioner Becker. Is there a second?
I'll second. Yeah.
Seconded by Commissioner Denny. Any discussion? Any discussion? Hearing no discussion. Do a regular vote. All in favor?
Aye.
Opposed? Ayes have it. Thank you, Jackie.
With the West Union one.
So,
What are
can
we
you
doing?
move on to standing reports?
Well, what about the West June 7.1?
It's pretty simple.
Oh, you're going to present it?
I can
I
if
think
the
it's
board
just,
wishes.
it's just the same as what we did.
I don't care.
Last time, I
I don't care
believe,
who
right?
presents it.
Okay, I can read it.
There you go.
So it's for the 2025 city prosecution contract with West Union. Background is proposed 2025 agreement for prosecution services, West Union, submitted after all other prosecution agreements were approved last month. Your options are to approve or reject this contract. The recommendation is to approve the 2025 agreement for prosecution services with West Union.
Thank you for doing that. The 2025 city prosecution contract for West Union, we need a motion to approve.
So move.
Thank you, Commissioner Newman. Is there a second?
Second.
Commissioner Denny seconded. Any discussion? Any discussion? Hearing no discussion, all in favor?
Aye.
Opposed? Ayes have it. And what do we got going on with the auditor treasurer these days?
Well, we're collecting taxes like crazy. Those tax statements went out, and it's amazing how fast people are paying, which is great. So we're getting flats of mail daily, so my gals will be busy doing that. Last week, I attended the AMC Leadership Conference in Nisswa, which was a wonderful conference. We have some election training today to recap last year's election, if you can believe that, today and tomorrow. But due to the weather, I think we're going to be watching by Zoom. And then as far as Osaka School District, I just wanted to recap that. That is the election, special election on April 8th. Polling hours are 7 a.m. to 8 p.m. There's one polling location for all residents of the district. It's the Ed Pollard Community Center, address 20 West Nokomis and St. Street in Osakis. And absentee voting continues to be available at the district office. And the school will have extended absentee in-person voting this weekend on both Saturday and Sunday, with the times posted on the school and the county website. That's all.
Wow.
Yeah.
Cool.
Okay. County Coordinator?
I met with a representative from the Business of Childcare, the Initiative Foundation, Long Prairie Chamber President, and Melissa Wyman from the Todd County Development Corporation. I attended a personnel meeting, prepped for the Long Prairie Gray Eagles career fair, went to the AMC Leadership Conference. We held a lunch and learn last week for the employees where Brian and Carmen from Freshwater District, thank you so much, came and presented on their services and taught us a number of words and phrases in the Spanish language just to help us all in our positions. And then I just want to end by saying a special thank you to Chris, Carrie, and Nellie in my office. They have been doing a bang-up job of getting out our retroactive pay and our salary grids loaded in payroll, and they've just been working tirelessly, and I just want to say huge thank you to them.
Thank you. Very good. And commissioner reports. Go ahead, Randy.
All righty. On the 18th, attended the Sauk River Watershed meeting. 24th, I had CPT in Morris, and as of now, we are doing like 30 clients with the payroll system over there. On the 26th, 27th, 28th, attended a leadership conference in Nisswa. I found that very, very good. I also would like to see if us commissioners, we can sit down and do a 5-year plan with the 5 of us, if we can do a work session, go through things that we think should be changed or not changed, and work on that. Also, I believe April is National County Government Month. I did get a hold of Julie Ring, and hopefully we can get some information. I would like to go to schools. We used to do that before. 3rd, 4th, 5th graders, have a conversation. Maybe we should invite a class, to come to one of our next board meeting on the, and they can experience county government. But I believe that's all I have.
I like that idea of the getting kids in here and have them see what we're doing.
Yep.
How it operates, you know? Okay, thank you so much.
That's all I got.
Commissioner Becker?
Okay. I attended a meeting with the City of Staples Parks Board, along with Jackie, and Stacy Prokachek was also there. And they're planning on 3 different trail systems. One's going out to the vocational school, which would be in Wadena County. The other one would be going kind of across from the tennis courts, so forth, in Todd County, and that would be a unpaved walking, running trail. It's on school properties, so they're really pushing that one. And the other one we're trying to connect would be also in Todd County, but from, continuing from the City of Staples to Delaware Lake. And they're working on a kind of a country route on that one. And we said we'd be very interested in helping him in whatever means we can to move that forward. So that was a very good meeting, startup meeting anyway. Also attended the feedlot meeting in Staples, attended the AMC leadership meeting and training, and also a Rainbow Rider meeting. Thank you.
Thank you, Commissioner Denny.
Besides my regular meetings, I did miss the leadership meetings last week, which sound like they were really nice, but only one to report on really was the Prairie Lakes one. We're just continuing to go forward with our ash utilization, reutilization programs as far as storage and getting it back into the road bed, and potentially working with MnDOT on that to solve some of that issue that we see coming down the road with having too much of it on hand. So other than that.
Thank you so much, Commissioner Naska.
I guess as meetings as usual, I did also attend the feedlot meeting that Barb attended, and it was good to see that many people there. It was a really good turnout. The food was great. Everything, I mean, it's pretty positive attitude. It seemed like the presentations were pretty impressive, and they were, I mean, it was very educational. AMC was out of the ordinary. I only made it one evening, but it was good atmosphere. For me, I'd never been to a leadership whatever, what did they call it?
Leadership conference.
Yep. No, never been to one of those, and it was good. Food was good. It was fun atmosphere there. I would also like to note that March 29th was National Vietnam Veterans Day. I'd like to recognize our Vietnam vets. We missed it by a couple days here, but I'd like to just shout out to that, because those kind of things need to be noticed. That's what I want to say.
Absolutely.
Thanks.
Thank you. Let's see, I had personnel on the 24th. Jack and I met with Attorney Lindeman on the 25th. And then we had leadership the following week, which was good. And the biggest takeaway in leadership for me was how impactful, like the speaker was talking about being intentional when you're talking to people. Like, we have a meeting with another person and you're always checking your phone, and you just can't keep your focus, and it doesn't seem like you're then there focused towards them. So even this weekend after we got home, I'm trying to practice that with my family, and it was good. It just shows people that you care about what they're saying. So maybe a takeaway from me, or all of us at the county, is you're in a meeting, try to be intentional with your focus and do that. So, and then starting to get some calls on our tax valuations that came out. Mostly industrial is all I've heard about lately. So, okay, that's it for me. John, you have anything you want to report, or?
No, I apologize for being late, Mr. Chair. No, nothing new to report from the County Attorney's Office. Thank you.
You're welcome. Okay. We move to work session? Take a little break, or get coffee? Tim, you need some coffee?
Yes,
You have to make a motion to recess, right?
Can I get a motion to recess, please?
so moved.
So moved. Maybe put that right on the agenda so I don't forget that. That'd be really great. And then seconded by Tim?
Yeah.
Barb and Tim, then all in favor?
Aye.
All right, grab your coffee.
It's right there. It's just in the bottom.
No, but it doesn't say make a motion to recess.
Bob, make a motion. We can do that.
I even did that. I wrote.
Yeah.
Need a motion second. Roll.
Right.
We're back in order now. Okay, we're
likes
going to
that?
begin our work session at 9:45 a.m. here, well, 9:43, a couple minutes ahead of time. And first up is our K-8 interpreter job description proposal. Please proceed.
Morning, Commissioners.
Morning.
Morning.
Chair, John. Yeah, thanks for gathering us all and getting our attention. But our first item for discussion on the work session is the paraprofessional case aid job description that you have here in front of you. We're looking to revise this job description, and Catherine will get a little bit into that, but to add interpreter into this role as that's primarily what this job description has been doing
So this will actually be a new position for the county, and I think it will benefit multiple departments' units because we've had a paraprofessional case aide job description for a long time. We have the opportunity now to revise and create this new job description. It won't replace the other one. We'll still have the other one because we do have workers in that. But this will be called a case aide / interpreter. So as you guys are well aware, we have over 40% of our clients in public health are Spanish speaking. And we've seen the need to hire more bilingual employees. An interpreter does something different than just speak Spanish to Spanish speakers, right? They interpret for our nurses when they're doing visits. So when they go out to the home to do a home visit, when they come in for WIC appointments, things like that, our clients, we then have this person who we currently have hired but needs to have their job revised, interpret for that staff. So I think this will be a really great addition to the county as a position because currently for interpreters, we had a contract with VITA, which is no longer exists, which was $40 an hour. We pay $1.50 per minute for our interpreter line. So if you equate that to an hour, that's $90 an hour. And this utilizes our staff best because they're able to be a case aide, do a lot of support with our clients, and then also act as an interpreter as needed. So what I did was modify the job description to add those interpreter duties, specifically English, Spanish. You know, that's something we could look at down the road if we ever need a different language. The requirement is 40 hours of interpreter training. That is a standard across the board. That's what allows you to get an interpreter certificate. And the staff that we currently have in this role has that certificate. So that would be something that would be required in this new job description. Questions?
So this wouldn't be an additional staff member, it would be a revision of a current case aide position. So it
Right,
would
I'd be posting this as a new job. My current position would apply for it, and then that position would go away in my unit.
So, Mr. Chair, I got a question. How many languages are spoken, different languages are spoken in Todd County?
In Todd County, I wouldn't know every single one. We know we have our Amish population, which speaks a High German. We have our Hispanic, which is very large, and then our Haitian population at this time that I'm aware of. Could there be multiples? Sure. But at this point, Spanish is our predominant language, second language that we have to address.
So we have no idea how many different languages are.
Census data you could look at and address that. I would be surprised if there's many other languages besides those spoken. And again, that's only if it's reported in the census. That'd be our only way to know.
Mr. Chair.
Jump right in.
Thank you. Did we not already hire someone in a position like this? I'm trying to think of going past to the personnel meetings in the past. Wasn't that part of it?
So we had a health educator we hired who was bilingual, and we revised his job description to add interpreter duties as well. And that was done about 3-4 years ago, I want to say. That person continues to interpret as well for our agency.
Okay.
This is a lower rate of pay, which I think fits more with what is traditionally paid for interpreters. So in my agency, or my unit, I have 3 bilingual staff right now, and we really need that many to support our population.
I guess what I'm going to question is, do we need, are we saying because you can't speak Spanish, you can't apply for this job, basically?
So when we hired the paraprofessional case aide in my unit, it was specifically linked as bilingual. So I wanted a bilingual case aide, right? So yes, it is required that you have the interpreter training and you need to be bilingual to be in this position. And that has been in other positions in the county. Sometimes it's just graded higher or scored higher, but specifically the job that would be replacing the one I have, that person was hired as bilingual.
Okay.
It's pretty obvious that the need for this is not going away and it's not getting less. It's getting more and more by the day.
Yeah, our family home visiting caseload, just for an example, is at 45% now Spanish speaking. It was 20% about 5 years ago. So I don't see that changing.
My next question, is there different lingos of Spanish?
Dialects?
Yes.
There are. It can be challenging at times, same as in the US when we have different dialects. But most who are from this area and speak the language have the correct dialect.
Okay.
And it is an opportunity to offset some of the costs that we are expending for the language line. As Catherine had said, it's
$50 a minute.
$1.50 a minute. So it's a way to kind of bring some of that cost savings back.
Well, and what has helped a ton is by having a case aide who can interpret. That person can follow up with the clients when it's not needed to have a nurse there to help them with additional resources, connect them to things like the food shelf, healthcare, and that allows our nurse to not have to do those things, right? So it's really been a good fit in my unit to have a case aide who can also interpret, because then it keeps the nurse who's paid higher having to do those things with a phone-based interpreter, which can take a lot more time.
Okay. And did this go through the personnel? And has Nellie seen the job description?
I got a copy of it, but it was not read.
Okay, so that's got to get done.
It did go to personnel.
We did go through personnel. I mean, we had a personnel meeting last Monday. I have a bunch of notes here that I'd like to review with you too. The job description itself has not gone through HR or, I mean, we need to get these job descriptions to go through and make sure that it's good by everybody, so. Let me ask my quick questions if I may, please. Is this, you're rolling, the current position is rolled into this one, is what I wrote down from Monday, right?
Correct.
Okay. Everybody understand that? Okay. I also have a note about grant position.
This is fully grant funded.
Okay. So I would like to make sure we understand the terms of that grant, like, is there a time limit on it? I mean, you know.
Currently,
I've had in my question in my mind, just in 100%, when we have a grant position, what is that grant period? Once it's a grant period, does everybody go, oh, we forgot about it, it's still needed or not needed?
Yeah,
Is there a time frame? Is there a sunset? Is there a need? Because then it becomes a levied position.
For sure. And we've dealt with that for years under my unit. The grants come and go, right? But staff are important. So currently, the Promising Practices grant covers is 75%. We have that for another 4 years through the Department of Health. It's funded as a family home visiting grant. 25% is funded through Foundational Public Health Responsibilities. That's base funding for public health. Absolutely, if Promising Practices went away for some reason or another, and that supports 2 of my nurses at a 0.30 FTE, I would be looking for additional funding. I do think the need is very much there for this position in my unit. I don't see it going away.
I had a note about the 25, 75%. I wrote down FPHR, so like I always talk about, the acronyms are a little not familiar to myself. Let's see, what else. So I do think there was, I mean, in reality, I think personnel, it was a limited personnel meeting because there was some absentees, but felt that it was a desire or need. But what hasn't taken place, in full transparency, is that with all the workload with back pay and stuff going on, they haven't fully looked at the job description with 100% eyes. So
we have time.
I do need that to happen. It's like asking somebody to open up a bar, but the checklist isn't completely done or something, or whatever.
Yes.
You know what I mean?
Yeah.
So, but all the commissioners needed to hear this stuff so that they
Okay,
understand.
let me just respond. HR's at personnel. So the job description was floated to personnel, but I understand that there is lots of things going on with HR, but it did filter through the right channels.
It totally,
I want to
yeah.
make sure that you understand that.
No, they should everyone understand, they did go through, there's no, yes, 100%.
Okay, thank you.
And after that meeting, it was discussed that we got to get this pack pay done and all the stuff done. And I said, well, if you still wanted to bring it to the board so they understand that it's a grant position, that it's being rolled into another position, that would be good, because we really never really, in my mind, discuss these things as wholly as possible. And with open meeting laws, this is the one time we can do that, so.
Yeah.
I think we need to give them their opportunity to look at it, and then, we can.
Can I ask one more question?
Sure.
Case aides, how many do we actually have? And this is just rolling one into another one?
I've got,
No, we've got one in multiple units. So we have one open in our financial unit. We have 2 or 3 in our adult services. I'm looking around.
And you know, we have new titles, so it's hard to track the previous name as a case aide to the new.
Yeah, 2 of them just moved now. About 6. I think
Are
6.
they ones or two? I mean,
No, they're all just.
It's just case.
okay.
It's not like support staff. I'd say about 6.
Yeah.
Okay, and they go in between the different divisions then?
No, they're pretty set in
They're
their
pretty
unit
set in-
within HHS, correct?
Right.
Okay.
And they're,
Oh, yeah, child protection
I was
has
just gonna say,
one or
HHS is a
two.
big, they're set within child and adult, or just,
and they're pretty specific, providing office support to the different units.
Well, on direct client services, the difference between office support and case aides is direct client services. And that's really what I think is important to know about a case aide interpreter role, that pairs really nicely together. And like I said, I think this is a good change. We've talked forever about paraprofessional case aide, dropping that paraprofessional word because it confuses people, you know? So this is a revision to do a case aide interpreter, but I think a larger revision to the case aide would be interesting as well. But Natalie knows this as well. Like if we don't put in their specific qualifications for this role, then, you know, we're not going to hire the right person.
And the job descriptions are fairly generic, so we're able to utilize them related to their specific unit, as
Sorry.
we have 4 different divisions in Health and Human Services.
Bob was just
know,
showing
I
me
think-
your org chart. They've got them written out.
Yeah.
It would be nice if we all had them, actually. I was going to try
I
to
think
print
that
one
is
this
housed out of
morning.
your department,
Yeah.
so Chris Kasubi creates the final copy of that.
you know,
Yeah.
like I was telling Barb, so
Yeah.
I'm pretty sure we're talking about community health, that's Catholic.
Correct,
Right.
yep,
There's one called paraprofessional case aide.
correct. That's the current role.
That's the current role, which now would be called
Case aide interpreter.
/ interpreter. And then when we ask questions like, how many case aides do we have? Well, I see one under child support,
There's one in
Adult
adult,
services.
couple in adult.
you know, financial has one, I believe, right?
Yep.
Yeah, so, like, when you bring that, when this comes up next time, or any department that's as complex and interesting as this whole area, perhaps that one spot is highlighted, or has a flashing thing, or it says like Bart Simpson, don't, that's the one we're hiring for. It would really help me personally, but I think the rest, I mean,
It gets
because we
huge.
get lost up here in the complexity and the acronyms and the, you know, wonderfulness of the department.
The other thing to keep in mind that I wanted to remind the board of is once we have a job description that the board is okay moving forward with, then we would have to bring it to Gallagher to potentially see, do these duties, would they want to see it and regrade it? Or is that not a high enough change where they feel it is similar to the case aide? And that's where we would rely on Gallagher, because they are.
And yeah, so, Mr. Chair, if I might add that Gallagher's the new one, I think we're all kind of wondering what the next step is, if it's gonna go higher or stay the same for the grading. I don't know that. I don't know how long it takes them to even grade it, but I don't even know if it's a reality if we can't get through work session to say, yes, move forward with taking it to Gallagher to see what the implications are for the board.
Well, I
As
think admin's gonna have to tell us what, I mean, if you even know, like, how long does it take to get Gallagher to say, this is not, it's the same pay grade or whatever, you know?
I would have to ask them what their turnaround time is. I don't know, and that,
Why we kinda thought bringing it here first.
Where in your current to-do list would this might fit, maybe, to find that out?
I mean, I can work on it. I just need a red line copy. I need a Word version. I have none of that as of now.
Wonderful. Well, then I'm assuming the appropriate parties, which would not be the 5 of us at this point, would be.
Yeah.
We'll get it to her, and which
And
is
then I
unfor-
can, start working on it, and then I guess my question to you would be, do you want it brought back to work session?
Are you
up to
able
date.
to get it to Gallagher? I mean, does it,
Or do you want it to go to Gallagher? Because I believe it's $500 every time we send a job description. So that depends, like, how, do you want me to send that to Gallagher before it goes?
We would like you to spend as little as you can and do it as efficiently as possible. So that's your stadium, man. You know, you're the coach on that stadium.
But I guess my question is, if you don't want to move forward with this,
I wouldn't send it to like, I kind of need direction from, whether it's the board, personnel, and I guess we could bring it back to the next personnel committee when we have the final job description and go from there.
My thing is this employee is working outside of the job description, and it is each day costing the county more money by utilizing the language line. So,
It is,
yes,
100%.
double-edged sword. It might be $500 for Gallagher, but it's gonna cost you $500 a lot quicker in human services or public health by utilizing the language line. So,
I personally don't see a reason why it would have to come back to personnel.
Right, me neither.
I mean, we had enough voting quorum, whatever, to be okay there, you know, and, you know, I have a sneaking suspicion that there's gonna be a special session coming up, which you could add this to, who knows? I mean, but it's gotta come back before work session to get to the board, because they've got questions that have to be answered, right? Or the job description is such that,
So you want the job description brought back to
Nellie?
next work session? Is
Oh,
that-
excuse me.
well, we gotta, how do we make a decision if we don't even know where they're gonna be placed on a scale? Here, let me throw a dart.
well, again, work session's discussion, you can't make a decision at the work session, which is why you would want to bring it to board in my kind of history, to be able to make a decision when there's implications that are going to be attached to it.
What's the rest of the board? I'm the
Mr.
one.
Chair, if I could.
Yeah.
Is there anything changing on this job description other than the Spanish-speaking part of it? It's just adding the Spanish-speaking part of it?
It's adding the
And the
interpreter
gal,
duties.
or the person is already employed by the county? And
Correct.
she would just switch from just job description to this job description, hoping the pay will go up so she will get reimbursed
I
for
don't
her
know
Spanish.
if the pay will even go up.
Or-
I don't even know.
We don't know that.
We don't
That's
know.
the part that we're guessing at.
Yes.
Well, and
Is
I
if the
will
pay would
say,
go
if
up.
the pay does go up, we can cover that under our grants. Again, as we know, we're going to have to budget for increased salary costs in those
But
anyway.
the only part that's being added,
Yes.
the whole job description is just the Spanish speaking.
Yes.
But if it's also a new position, we would have to post and rehire and re-interview.
We would have
Yeah.
to,
Need to do that, yeah.
okay, then you get into another problem. Does she have to quit her other job
Nope, it would be,
before we can hire her into her new job?
nope, that would be an internal move. As long as she would apply. If she wouldn't
Does she
apply
have to
for
apply
this,
for the
then
new position? She would have
yes.
to apply.
she would have to apply
The other
because
position is going away.
the other
if it's-
position would be going away. So if she doesn't apply for the new position, then
She
she
would,
could potentially be out of job.
correct.
And will the union come up and say that we're not doing this correctly?
No,
I
think
mean,
we
as long, yeah.
Could be by posting it.
Commissioner Becker, I was just thinking on this because, and this is why we were kind of frozen in time in administration, is because we didn't know that's why we wanted the red line in the job description, so that, and hearing this today, that it's only the language piece. It's possible that Nellie and I could reach out to Gallagher. They're a new relationship with us, but maybe we could ask them just generically, if this position is only adding the bilingual piece, what's their take on it? Are they, maybe we can get some direction. Are they going to tell us that's not going to be enough to move the grade change on it? Or yes, that could, but we want to see it. They could say that to us and we could get some better decision. We just need to get that. We needed to see that copy though, so that we know exactly what's changing in it or not changing.
And Mr. Chair, if I may, we can hold on bringing it to board until, if that's, we're waiting on Gallagher.
I was just gonna say,
I
mean,
think that's the
bring it-
direction you
that-
have to go.
Right,
We
but then
certainly
I
can
guess
do that.
what I'm asking is, who do you want to make the decision on, yes, this job description is good to go in Gallagher and this is the final? Because I guess my concern is, I don't want it to go to Gallagher, and then after they grade it, it's like, well, wait a minute, we should change X, Y, and Z. Well, then if it wasn't final, approved, ready to go, got everyone's blessing, why'd I send it to Gallagher?
Could always remand it back to work session from board if it's on the agenda.
But what I'm saying is, I don't want to send it to Gallagher if, like, it doesn't have the proper blessing.
let's send it to Gallagher, get it figured out.
Well, I think that call to Gallagher first, if we're only changing that portion of it, get the job description, changing only that portion of it. So we're talking the same piece of paper, same job description. Yeah.
Call Gallagher then.
You have to
Call
do-
Gallagher and
Yeah.
it is what it is. Like Jackie said, I mean, if it's, we're spending whatever every week extra on the stuff, pay the $500 and let's move on. Should be simpler than what it is, but I understand everybody wants to dot their i's and cross their t's, so make the call, let's go. Everybody clear?
And I would suggest that if it comes back, if they want to talk to Gallagher, and you guys are okay with it, is to bring it forward.
Right.
Once you get that information back.
We're on board.
Any further discussion? Does everybody know what we need to do or what to do next? If you don't, we can stay after and write it on a chalkboard.
We'll have a similar discussion with this next as
Super.
well. So it's good discussion to have, it really is. And being new with Gallagher, I think we're all just trying to figure out what the right process is, and we just want to be sure that we're following that. I'm going to move down one. I wonder if we should grab another microphone.
Look at
So
this
we'd be sure
whole-
that
yeah.
everybody talks into what I've
Getting
heard.
ganged up here.
Yes, please. Thanks, Mike.
Thank you.
Yeah, okay. Thanks.
Is this the one from previously?
Yeah. Thank
You
you.
know what, Bob? This is that last one, but this is where
Did you want to end with the media? John, did you get that? All right, so next discussion is the Administrative Services Manager position. We had posted, gosh, Nellie, how long was that up? Month? Jenna's position? It's been a while. But with that posting, you know, we got some applicants, some that didn't meet the minimum of what we were looking for, some that did. It just really wasn't what we were looking for at the end of the day, so we're just looking for different ideas of how, that position, the manager position is a pretty big position. It can be pretty overwhelming, or has been overwhelming. It's a lot of responsibility for one person, but Jenna had been with us for many years, and it worked while she was here. So as we try to look ahead with Jenna's resignation and now contracting, and I thank her for contracting with us and staying on, as we do need her expertise, and that role is critical to our levy and the data that we input and the audit that reflects back on the county and our department. So as we looked at the position and the applicants, we know we're in a position where there's not a lot of workforce out there to select from these days. And really, what are our needs as a unit as a whole? So as we break that down, we looked at the cost implications as well. You know, can we move forward with this being an accounting supervisor, and then split off some of the staff that she had been managing or supervising, and just taking that accounting staff and placing it under that accounting supervisor, who generally has experience around accounting and general ledger and Excel and data input and IFS, and supporting the auditor treasurers, because our numbers reflect what's in the auditor treasurer's office and the work that they do. We work very closely together, and the numbers have to be right. And then we look at the front desk that was under this position, and really the work of the front desk and two case aides is really supports Stephen's unit and the applications that come in around the programs that they have, the multitude of programs that we just handed out to you, and outlining that. Do we break it down to build it back up? There's some opportunities here. And it's gonna take us some time to try and figure out how we wanna do that. We have a general idea and a rough draft, but that's what we wanna present to you today. I asked Stephen, Julie, and Laura, if you can give me a copy of one of those, to look at all the programs that they have within their unit, and you can see the multitude of them, right? There's a lot of them. And all of those programs they're different programs. It's like a client. One client is one client, and we typically don't see a lot of them. They're very specific to what their need is, as well as these programs. These don't overlap. They're different eligibility, different applications, and you have to treat them all separately, even though one client or one family might come in applying for every one of them. There's still one application for each client. It's a lot going on in that unit. So with that ask, I'm like, okay, what do we need to support the front desk and the staff that's in the financial support unit? We are seeing some turnover because of the program complexity with those multiple programs. That's being rolled down from the state, out of our control. We're seeing staff being burnt out. You're seeing years of service here as of today. As eligibility workers, less than a year, there's 6 of them. We have a more solid child support office that have been here and have stayed. Not a lot of change in child support, and we appreciate every one of those that have some longevity. And then we see EAP with the Energy Assistance Program that's in the last column. And then at the bottom, we have the Financial Services Unit, which is Stephen's unit here, and then the totality of those numbers. I also wanted to identify the caseload sizes, which are extremely high. Extremely high with even those with less than a year of experience and those who have a great number of years of experience that we lean on to be able to support the new staff. We are in need of additional lead workers to be able to support the staff. We're seeing turnover. It's just the workforce that we have today. People are more mobile. They are leaving for other counties and to be able to have some remote work opportunities. So we're coming today to ask for 2 additional lead workers, or some discussion, I should say. We're not asking, we're up for discussion, for 2 additional lead workers to better support the staffing needs within this unit, because we're seeing eligibility workers, there's a rotation of staff, unfortunately. And it takes, as I think we've talked about before, it takes 2 to 3 years for these eligibility workers to be proficient in processing applications. This is where I'm gonna kind of hand it over to Stephen, Laura, and Julie to talk about more specifics, but in general, there's gonna be some cost implications, and I shared that with you all, as to what it would look like for 2 additional financial service lead positions, and then we have some state share that's in that. What it looks like if we would add 1 supervisor position versus 2 lead positions. And the lead positions are gonna be, they're not confidential employees. They are a part of the union, but they're gonna be more generally boots on the ground that can also hold a caseload, but also work one-on-one with the new staff. And then I also added on there the 1 fiscal supervisor or accountant supervisor that I had shared with you earlier. I think we've got some cost-saving opportunities as we potentially look out into the next year or 2 that we could help support that those additional lead positions. But it's really, at this point, critical, or a need of the unit, that we better support their trainings. We did meet with the staff this morning, and it was something that one of the new workers had said, we do need more support. And I think we can do a better job with training and providing one-on-one dedication that they need. But anything you guys want to add around program complexity, the volume of applications that are coming in, and just, again, breaking down what we currently have to build it back up, to do better for our staff and in our trainings.
Good morning. Yes, I'd say the, probably, when we're looking at those caseload sizes, so when you see an average of, 150 in the Maxis system or 534 in the METS system, in all honesty, in the last 3 to 4 years, we've never been at that. So you have, if you see how many, new workers we have currently and how much staff we've had turnover, they don't have the capacity to handle a caseload of that size. So the more seasoned workers, which are increasingly becoming fewer, have to take up that slack. And so like currently, the METS, the 2 METS workers, one is above 800 right now. So, and they've been like that for some time. So I just wanted that, ideally with those caseload sizes, that would be where we would be looking at, like that's the ideal situation. It hasn't been like that, for quite a long time. The programs, like you can see the extensive amount of programs that we have. It really does cover a lot of different populations. So the 3 of us somewhat split duties as far as the programs go, but we all 3 need to be very aware of the policy and procedures for all the programs, because we're referring back and forth between the programs. Like Jackie said, you can have one household could apply and potentially be open on all of those programs at one time. And determining the eligibility for them each separately is very time consuming, particularly with foster care, long-term care. Those can really get pretty complex and drug out there. But yeah, what we've worked on recently is getting more of an adult and families and children split, so that we did make that change with I suppose it was about a year ago that we did that. Just all we could essentially do is take one major program away for each new worker. So hoping to get them up to speed faster. I think it is helping. I think it's a better way of doing it, but it does add some complexity with backup. So then if you have somebody that's very focused and only does family programs and doesn't know the healthcare for elderly and disabled, then, if that person's out, then, it's more difficult to get coverage. But it's been something we just had to do because the training they need, if they're here under a year, they need one-on-one attention. They deserve it, and they have to have it, otherwise they don't get that foundation. And that's very difficult right now with just one lead worker. She's just overwhelmed. There's too many new staff to keep up with that. So we're trying to cover those training needs also. Well, then all of our other duties are, some of which are very important to the unit, and the programs are kind of being put on the back burner. So that's where we would look at the need if we're taking on more staff. In addition, that would be the ideal, is having more experienced, that we can trust that they know the policy and they can field those policy questions and procedural questions. Maybe hopefully freeing up some of our time to increase training and get things more streamlined. So, anything you guys want to add on?
I think you said it great, that, the intention is to provide that support for those new workers. That they need it, they deserve it, and if we're taking on additional staff and duties and programs, it's necessary.
Questions, anyone?
Yeah, I guess my first question's got to be, what are we seeing coming down from the federal and state government? We're working with this on the bottom part, but our top parts are moving every day differently. Do we even know what we need yet?
It's hard to have.
On our end of it? It's, especially after going to the leadership conference, there's a lot of talk about that. We don't even know what's happening at the state level right now.
It's hard to have that magic 8 ball. Commissioner Becker, I agree with you. As if we did, we'd all be, better off. But at this point, as we, they're looking at anything that I've seen on the Health and Human Services side be really COVID-related. The programs and services provided in Stephen's unit is around healthcare, and we haven't seen cuts to those areas, those federal programs. So it's not tied into COVID. So it's that magic word of being, ARPA or COVID-related that we had seen those cuts be affected, and we haven't seen those. These are more critical areas that have not seen the cuts. Essential, I shouldn't say critical, I should say essential services and programs that have not been a ripple effect of the cuts from the federal government.
In the personnel meeting, when we had some discussion last week, it might be helpful. It was helpful to me that day, so maybe it's helpful to you to explain to everyone the process. I mean, you outlined here all these programs that we have, financial support services programs. But if a family comes in and wants to apply for half of these, how long does that typically take, and what's the process? I mean, I think you know where I'm going with this, what you explained to me.
Yeah, it depends on, so with the major programs, when you're talking food support, the healthcare, medical assistance, and those family cash programs, and the adult cash, there's one application, so it's called the combined application form. It covers all the programs. So when you get into healthcare, then it gets broken down into, if you're an adult, or you're an adult with no children, or you're a family with children, that's one application. If they do the wrong application, they fill out one that was meant for adult or for long-term care or something, then they have to fill out supplements to get gather the information to get them determined. There are different timelines for processing requirements, generally for food support. If an application appears expedited, which means their resources are, 0 or very low, we have 24 hours essentially to get that processed, the max of 5 days, but we can get penalized then if we're not processing them timely. So there are, and then of course emergency assistance. So if somebody has a disconnect or they're being foreclosed or an eviction, that's obviously an emergency. We have to drop everything and tackle that immediately. Then when you get into healthcare, it totally is dependent on the population. A pregnancy would be 15 days that we have to process. Adults, most of the population is 45 days. And then when you get into the elderly and disabled population, we have 60 days. That would probably stem from just the complexity of assets, checking, assets and all that information, which with families, there's no asset, test. So it's a little bit more streamlined in that sense. So there are different processing requirements based on the program.
So, Mr. Chair, it boils down to the vintage programming that the state of Minnesota is using. And with conversations with other commissioners from other counties, it's basically the same thing. Our technology at DHS sucks. That's the bottom line, okay? And it's the curly shuffle. You're trying to figure out what program put people in. The programs do not correspond or talk to each other, so you have no frickin' idea. So you're doing one separate one over here, one separate one over here, and then trying to figure out, are they both compatible? It's just, and that's where it is, okay? So it dumps on to the smaller counties like us who have limited staff on these 25 different programs that one individual is trying to deal with, where if you go down to Hennepin, they have 20,000 employees working on individual programs. That changes the whole dynamics of it. But when you get outstate here, we're screwed, okay? So it's either add more staff or work on our legislators when they come in here in 2 weeks and tell them, DHS needs to improve their technology. Okay? That's the bottom line.
Mr. Chair, if I might add, I did meet with Senator Utke and Representative Weiner last week on the very thing. System modernization for Health and Human Services needs to be fixed and needs to be prioritized. It's going, their 10 million that they allocated is a drop in the bucket and isn't even gonna touch the enhancements. They need probably more like 200 million just to create a system that is functional. And I believe Representative Weiner said, we're still doing the Oregon Trail computer system, and we are. All of us that know what the Oregon Trail is and the DOS-based green screens. Wouldn't it be nice to be able to input client data and whether they're a family or individual and say what their income is, and boom, it's gonna populate out what you're eligible for?
Yep.
Seems like a great world, but that's not the world we're living in. And right now, the application side of it, so clients or people, your constituents can apply, and it's very easy to apply, but once it comes here, that's where it's tough, because it's not easy to process these applications. They receive it. How do we input it? We try to reach back out to them. We're not getting calls. It goes in a queue. We have 5 days to respond. We have 30 days to respond. Depending on a different program, we have 45. We call, we get nothing. The application stays on, and in the meantime, 6 more, 7 more come in 2 hours. So it's overwhelming. People are burnt out. People are tired, which is why we're seeing people filter through these units. And it's sad. And is the program getting out to the clients? Yes, but sometimes not within the timelines that it should get out. So we're just trying to stay afloat, and we're about right here right now. And unfortunately, we're not the only ones. And then I go to the metro and I hear, oh, Hennepin County approved to hire 30 new people to do this work. And it was nothing for them to be able to hire that volume of staff. And then they take up all of our training slots, so we can't even get in to train the people. And then DHS cancels the training because the room wasn't full.
Right.
Or they say, oh, your homework wasn't satisfactory enough, now you gotta come back 2 months later. So what do we do with the staff in 2 months? It is so darn frustrating. But yet, who suffers is us and the clients and the staff here. And that's where we're trying to do our best to stay ahead of the curve and give some of that time back to the staff that need the one-on-one. And it's needed.
And Mr. Chair, our county population hasn't really skyrocketed. I mean, we've been stuck at that 25,000 in that area forever. And it seems like this stuff never ends. It's just a continuing circle.
It's depressing.
So you're thinking about adding a couple leads, is what I remember from the personnel meeting. Is what we're talking about, right?
Yes. Our ask for the financial services unit is to add 2 leads to better support the staff, but also to take that manager position and make it a supervisor position for the accounting side of it that is still a great need, as Denise could probably.
I mean, in the personnel meeting, the thing that intrigued us was the fact that they'd be leads, not supervisors or managers, and that they would be doing have some caseloads. Because, I mean, no matter how we skin this, the only way to alleviate the stress and get this is 1 or 2 ways. It's addition or subtraction. Addition is the adding of people that can do the paperwork, that, not just assigning the work, but actually doing the paperwork, or taking a look at these 17 services that are listed here and see which ones aren't going to make the cut, that aren't not state mandated, that we as a county offer to our constituents that would have to go goodbye. That's the end of the story, and it's a very difficult. You got to be. You better put on your shoulder pads if we're going to take that discussion, folks. I mean, I'll go in the huddle with you, but that's what it amounts to. So, if any of the commissioners or support staff want to dig into what services we do or don't need, or we mandate or not mandated, that's fine. We can do that, or we can look at these staffing requests and decide how to best utilize these staff folks. You know, the two potential leads, and you have to manage that, but.
And, Mr. Chair, if I may, similar to the last discussion we had with the case aid interpreter, the accountant supervisor would be a new job description. So it's not redlined as Nellie had, shared with the last. It's a new position. We would eliminate the administrative services manager to create, if we would move forward with that. And that would need to go to Gallagher again, similar to the last one, to see where that landed, because again, we already have lead positions, so that would look the same, be the same, feel the same, but that supervisor position is a new position and would need to be evaluated by Gallagher.
Mr. Chair, I would almost like to have another work session on this, a special work session if we could, and just dig into this topic deeper, because it's getting later and we have people looking to move on. But I think it's a discussion we have to really sit down and have, and if it's maybe not even after a meeting, a different day, whatever, it would be really interesting, and to get the org charts out here, because we don't have that in front of us this morning. You know,
Right, I did
and just
email
really
them and
deep dive into what is really needed and where are these people needed. Yeah.
Well, that's fine. We just have to commit to getting, if we're gonna have a special session with stuff, we gotta, everybody's gotta allocate 2 or 3, 4 or 5, the whole day, whatever you gotta do. We've just lost somebody this weekend or Friday, a veteran,
Yeah.
and, you treat this like your own house. You can't pay the bills, then you don't get to eat steak. You eat bologna sandwiches. That's what this is bound to. So I'm fine with that. You four wanted to get together and spend 8 hours, we could do whatever. We're here today, and I understand there's additional people waiting to speak, but we have to, no more kicking the can down the road, folks. Next week, we'll probably lose someone else. And then we'll say we didn't deal with this. And I understand. I want you to have all the information.
Yeah,
But
is it the easiest just to add more people? But are we really taking care of the problem? And we don't know what's coming down from the state yet either.
Yeah, right.
I mean, it's a mess. It really is.
you have to have the right information to make the decision. I totally get that. Makes 100% sense to me. So someone put together the invite to special session and bring your lunch and your dinner and your breakfast, and we'll plow through it.
I might add that, Mr. Chair, that we also have held on are filling 2 social worker positions for
I
the
was
same
going to
reason.
ask you that. You
Yeah.
still have 2 positions there within the budget that have not been filled. Yes.
And one's been since Teresa's position last fall? Okay, December? Yeah, we didn't. We're holding on that one. So it's been quite some time.
Yeah.
And then when Dixie left a month ago-ish. So we're holding on that one as well. With each opportunity or turnover, we look at really what our needs are, because they do change from day to day in departmental needs. So there are some cost savings that we do have within our budget, I'll just throw out there. And I think we've got some opportunities that are coming up in the future, but
For 2020,
Similar to-
2025, we are April 1st. How many open positions do you have right now?
oof,
Not counting what happened on Friday, or whatever day it was.
care coordinator.
How many,
2 social workers.
in this whole chart, how many positions are open?
That are budgeted.
7. So we're 1/4 of the way there, and they've been open, how long they've been open for?
Some of them have been quite a while.
Okay, let's just say since the first of the year. Just to be, and if I'm wrong, I'm wrong. My point is, you've just saved a quarter of your budget for 2025 because they haven't been filled. We're never going to get these filled.
But are they being advertised? Some of them are
Yes.
not.
Some of them aren't being advertised.
The two social workers, we are not. We're
Okay.
holding on those.
So there's only 5 that are being advertised that aren't filled.
Okay, 5 then, that's the number.
There's not great applicants. With care coordinator's been open since this fall.
5 times a
Oh, did you?
5
But it's
times
been
the
open for
salary and
quite
a
a while.
benefit is gonna equal, in a year, what? $400,000, $350,000, $400,000. We've saved a quarter of that, that's about $100,000 right now. We haven't spent, that they've been open since the first of the year. Okay. Anything else, any discussion?
Next steps, I guess, is what I'm looking for.
It sounds like we would need to spend a healthy amount of time with your team again in a special session. Work with admin to get it on the calendar, and I'll be there.
We'll need the 3 days to post, right, Denise?
Mm-hmm.
Maybe we should have board meetings every week for the next month or two, on to every Tuesday. Try to get this one on this calendar if you can, and we'll go from there.
And so what would you like us to be prepared for, so we're not coming in blind and have the answers?
Anyone?
I'd like the org charts, printed. And they actually are on here, so you pretty much got them with the names and everything on. As services that we can, that are very, very much needed, services that maybe we could look at different sideways at, maybe they're not needed any longer. I mean, we did it away with healthcare, is there anything out there, is there not? We don't,
Okay, here's a
educate us.
quick question for you. Out of these 17 programs, they're all state mandated?
I would say excuse me, the only exception would probably be energy assistance, I guess.
Yeah, that's
Pretty much everything else is federally or state mandated.
Which one is not?
Energy assistance.
And a portion of that is state mandated, correct?
That, when we had come here for, I think it was last board meeting, the cost for that on the BAF was, I think, $60 shy of $21,000.
And that's in-house too.
That is in-house.
We've always kept that in-house.
Yes, we have.
Yeah.
But all of the other programs are mandated. There's no choice but to administer them.
I don't know if we can give you an answer what you need for the next meeting, but one of us will, either Jackie or Tim or I will get back to you. Sorry. We'll do a little poll after this.
Okay.
And try to get it on as soon as we can. I think, I'm just, this org chart will be great as somehow like a key, like, these are the open spots, they're in yellow.
If I do the detailed one, they'll say vacant.
Okay.
Or yellow, whatever you want to do.
I think I did send that out last week, so with the names and the vacancies too. So.
Yeah, and then, a lot of us, I shouldn't say a lot of us, I myself, can you give me an org chart with actual names on it or not? That would be great, because I know that, who's sitting in front of us, Lori, Julie, Steve, Jackie, sometimes I lose case of their actual titles and stuff like that, so.
We're trying to learn the titles from Gallagher as it switched to a little bit, so.
It may be a hypothetical what you're suggesting, because aren't you suggesting you take, that Stephen takes on front desk? So show what that would look like?
Yep, I can print that out. I think
Maybe,
I
I don't
sent
know.
that last week,
Just-
so,
yeah.
yeah.
And maybe if I could ask, Mr. Chair, if we could get a breakdown of how you're gonna divide Jenna's stuff up? Because it kind of looks like you're talking about dividing it up.
Oh, not really. The
Okay.
accounting stuff will go to the accountant supervisor. The front desk will go to Stephen.
Okay.
So when it comes to your world,
Yes, that's what I'm
that
very concerned about.
supervisor, accountant supervisor would take that all on.
Because I mean, just this, like, they know I was at conference and our auditor was contacting me because they needed to wrap up stuff, and there was like a list of Jenna's stuff. Thank goodness she attacked it, and it's all in. But I
Right.
mean, may not ever get another Jenna. I mean,
I don't-
in my audit world, in our audit, in our whole financial world, she is,
Yeah.
she's queen
Critical, yeah.
for your division.
Critical.
Get her
So-
back.
So I would like that, and then we also talked about in finance, Bob, Commissioner Byers, we talked about if they could do, and I don't know if it pertains to this, but a list of how many positions are,
That's push-ups for whoever that is.
the list of jobs are,
He said it's pleasant.
now I've lost it. Yes, the grant-funded ones, and how long they're good for, and, because we talked about this in finance, that we don't get a list, so we don't know how we should be looking at the future. Are they gonna stay there, are you gonna, so it would be kind of a nice, this person's grant-funded, this person, so we know how many, because you keep asking me how many there are, and I don't know that, so if we could get that too.
That's on the public health side.
Okay,
And they're, yeah, we can break that down for you. And it actually
Well, even
comes
if you
through
just
the
get that
Morrison
to-
Todd Wadena CHB.
sure, even if you just get that to finance, if it doesn't have to be part of this.
It's not a part of our budget?
Well, it is.
Okay.
Yeah,
That
but I mean,
goes
it's not listed
finance?
out, so we don't see
Okay.
it. Jenna would know it, and I could just say to her, you know,
Okay, okay.
yeah. Just an ask I was asking.
Jackie, I'll call you, okay? I'll talk to those, what they're asking for. I'll talk individually to each person, get back to you what I hear from them, and if they.
I just don't want
and
to
if-
come in here
oh,
blindly.
yeah.
I want to know.
No,
what
I don't
we're
want you to do work you
presenting.
don't want you to do either, so.
Yeah.
Thank
so
you
we
guys
can
for.
be prepared to answer.
Yeah.
But my next question is the accountant supervisor, we're gonna be in the same position, not knowing where it's gonna land with Gallagher. We have it, as I shared with you, as what Jenna's rate of pay was. I don't know if it's gonna be the same or if it's gonna be different. It's gonna be hard to forecast that, not knowing where
That's
that's
all right.
gonna
We'll
land
just
as well,
ballpark it.
so.
If we're looking for exact numbers, we're crazy. We'll just ballpark it as best we can. Okay,
All right, more to
because I
come.
do have the stuff you gave me, from the calculation, that's good.
Yes.
I'll start with that.
Okay,
Thank you.
yeah.
Chair Byers, we'll be skipping over number 3 and tabling that Sourcewell Career Pathways Program. So they won't be presenting at this meeting. They'll choose to come to a different work session. So we're going to go ahead and go right over to number 4, Paycom and the Morrison County Human Resources presentation,
There we go, yeah.
if you're ready.
I'm ready.
Okay, and they're ready, and they are here.
Welcome
We have
to-
Melissa and Beth from
Session.
Morrison County.
Good morning.
Yeah. Yeah.
Thank you for having us. My name is Melissa Sineski. I'm with Morrison County Human Resources.
Good morning. I am Beth Berg. I am the HR manager for Morrison County. And we are here to talk to you a little bit about Paycom. It sounds like you guys are interested in an HRIS system. Good morning, Nellie. Are we, You're on the screen. Oh, perfect. Okay. Just wanted to make sure we got connected. So, I'm kind of wanted to back up and kind of let you guys know where we started, how we ended up where we are. You know, in 2018, we knew that we needed a new payroll system. Thank you. This is all new to me, so. We did a new payroll system. Our current one was lacking. You know, I think your previous presenter talked about, you know, the Oregon Trail and the green screen DOS, and that's what we had. So spent a couple of years doing some research, looking at different systems and capabilities. You know, and we had ongoing conversations with our county board at the time, and there was interest in moving forward. At the time, MNCCC, if you're familiar, had gone out, had wanted to put a committee together to look at solutions statewide. And so they formed a payroll committee, and I sat on that board. And then, you know, we went through the RFP process, and their top two contenders at the time were one of the ones that I had chosen. They decided to go with UKG. And we decided to move forward with Paycom. They were a better fit for us overall. And so we kind of broke off from the MNCCC committee, and then, there we go. And so that's kind of how we ended up with Paycom. Let's see, so we started implementation, we started conversations with Paycom in 2020. We probably started our implementation process, you know, collecting all of our information from all the different systems that we had. And, you know, it was quite a lot of data to try to impose and bring into Paycom. And so then we actually ran our first, we spent a few months doing that. And then in June of 21, we ran our first payroll. Process was relatively fast. We had an amazing team. I will say we were held up in a conference room for quite a while as a working group, but we've had success, and we've been on Paycom ever since. We've launched multiple modules, and I guess I'm not really sure what Todd County is all interested in, but as you can see, so this is my presentation, right? So you're seeing my screen. So this is kind of what it looked like for us when we implemented. So I kind of want to give you an idea. You know, we had our people, we were utilizing NeoGov at the time. We had reporting to do for and background checking for human resources, or the Department of Human Resources. We had new hire reporting. We had all the forms, payroll forms that we had to do. We were utilizing e-time with RT Vision. And so it was a lot of importing. And there's the infamous green screen that we ran our payroll through. And that's just simply onboarding. So then from there, we also, you know, enrolled our employees into benefits. And that's, you know, a good chunk of the benefits we offered at the time. And so then that was going in each vendor and typing in employee information, collecting information, taking that information from the onboarding, you know, reroute them through their benefit provider, and then of course dumping all of that information into a payroll system that was becoming obsolete. Once we got to that point, you have all your other mandated reporting. You have IRS, you have the Department of Revenue, you have your para, you have your deferred comps, you know, and you have your ACH, your banking, your payroll. And so then it was a lot of steps, a lot of everything. And it's weird to kind of look at it now, knowing what we have, like, I don't know how we ever did it, but we prevailed, we moved on. So this kind of simplified the process. So with Paycom, you know, everything goes into one system. Like I had said, we utilize multiple modules within Paycom. The ones with the red X's we don't utilize. So you can see it's a much easier flow. So right from the get-go, onboarding, you have all your employee information. We have them, you know, we do applicant tracking. They apply online. The system takes that applicant's information. So it's a much smoother workflow, less human error. for data entry, of course. And then you have your, your schedule. It kind of keeps you on track on what's next, and it keeps you moving through the system. So much cleaner, much more efficient for us on our end. I'm sure like many before they implement with an HRIS system have a bazillion Excel worksheets that they're trying to maintain employee information on from pay and benefits and, trying to get all of your systems to work together. So that's been going really great. I'm not exactly sure what you guys utilize for your financial, but this also integrates, we use IFS. Is that where you guys are at here too? So our IT department had been very instrumental in gathering all of that data that we took from our old systems and building imports and implementing with Paycom. And so then it's been pretty smooth. We haven't had any major hiccups, anything that we have issues with. We have standing calls with our account rep at Paycom, and we work through them. And I think for the most part, it's pretty good. What we got for our investment, of course, HR compliance. As you know and you're aware, the 23 legislative session was was quite the active year for HR, and so we've rolled that into our compliance process. It helps us keep track, make sure we don't skip or miss, and implement ways to ensure that our employees are informed and that we are hitting all the marks that we need to. Paycom offers an audit trail. So, you with the paper documents, you kind of be like, oh, well, misfiled that, overlooked this or didn't enter that. You can go back and see who took what action when. The performance management tracking tools, that's something that we're actually looking to implement this year. We haven't utilized it yet. We've been working on our position management, and we just actually did a comp and class also. And so we wanted to make sure our job descriptions and our positions were up to date, and we wanted to make sure we only entered in the information once. And so it was kind of a waiting process through that. Personnel budget forecasting. There's a lot of analytics that come along with Paycom in that we can kind of see where we're spending our money as far as over time. It kind of allows you to see where you're at with budget. And, of course, as we know, people come and go. It takes a while for positions to be filled. And so you can kind of get an idea of where you're at throughout the year with your personnel budget. Employee self-service, that's where an employee manages all their own information. We are not taking bank information from them. They're entering all their own data. They're managing their own qualifying events for benefits. They have access to their pay stubs, their W-2s, ACA. So they have 24/7 access to that information. So they're not constantly coming to HR and asking for that kind of stuff. So redundancy reduction, again, like our mess that we had to what we have now. Time off management, has been amazing. So employees can choose to download an app on their phone, so you're not sitting here, at home trying to make plans over the weekend and you need whatever days off. You can go ahead and put a request in right from your mobile app. You have access to your calendars. If you allow your staff to have, work email access on their phone, they can kind of see who's gone and whether or not it's an option. And so it's so much easier for supervisors, department heads to go in and approve those time off requests, and as they come in, instead of, trying to figure out, who's off on what day, there's a calendar feature that they can see.
Can I ask you a question?
Yeah, of course.
You said they can use it like on weekends with their phones and so forth. So are they using county phones or are they using their personal phones?
So both.
Okay.
Yep, so we have, our cell phone policy is either they can use their own personal device and we offer them a stipend, or they can have a county-owned phone. So it just kind of depends on the nature of their work. And, you know, I will say not everybody has the app downloaded on their personal phone. They'll still use traditional computer. They'll take care of that work-related stuff at work.
Okay.
But some do appreciate the convenience of, you know, 24/7 access to time off requests, and they can see whether or not it's approved. You know, depending upon whatever the requirement or arrangement is made with their supervisor regarding those, or the department head. Okay. Expense management, we're utilizing that right now, piloting, kind of slowly rolling out to different departments. So it's been great because we do paper. We've been doing paper, gets submitted to our auditor treasurer's office, then our accounts payable has to spend time, verify receipts, make sure that people are within the policy parameters. We can set those rules in Paycom, and so the system detects if something is out of range, you can flag it. If it's on a weekend, if you're not expecting somebody to have weekend expenses, it allows mapping for mileage, so you don't have to calculate it on your own. You just put your start and stop destination, and it's been going really well. Just trying to get the expenses in our accounts lined up through our general ledger. So, but it's going well. People are loving it. Staff are excited about it. So, learning management, we have an LMS through Paycom. We do a lot of our onboard training through that. You can create your own, your own training and upload it, your own content. We did that when ESST came out for notifying our staff. We put a video together, PowerPoint additional information, and just pushed it out. So you can see when employees complete, look at, you can have signature sign-offs for any mandatory or required training in that realm. So that's been very helpful for tracking. Reporting and analytics, of course, so important. We were pulling from many systems. We have access to all the information within Paycom. We can create our own reports, and of course, there's standard reports that Paycom does provide and are pre-built within the system. So then we have, if there's any type of, I guess, any request, whether it's personnel, whether it's payroll, training, you know, within all the modules, we can run whatever reports that we want. So I guess I'm the main report runner for our office, and I have a lot of fun with it. So it's pretty great on the information that you can see. And again, reliable workflows, making sure that people are timely taking action on certain, you know, benefits, I-9s, W-4s, what have you. So just making sure that people are getting their stuff done on time. I mean, I can imagine that, well, we did take a lot of time looking over papers and making sure it's a lot of information to track just for one employee, let alone we have 363 employees. So it's quite a bit of work. Any additional questions from you guys at this time? Otherwise, I just do have one more.
On the real time, can you go back a slide?
Yeah, I sure can.
On the personnel budget forecasting, real time and forecast compensation. So like if I looked at the budgeted labor for HHS as of March 31st, I would have some telling me they're on budget or off budget.
Yeah, so I guess let me kind of show you what it looks like. We don't actually do like budgeting per se. You know, obviously that's a beast in its own when it comes to budgets, just but for personnel purposes, let me kind of show you. what the analytics looks like, and it might have signed me out.
Commissioner Byers, that would be down in my office in IFS. We could run a
Right, and that's also another.
report activity for
Yep.
payroll.
Yeah, but which would obviously be more accurate. I apologize. Got booted out. So, let's see. It'll give you an idea of where you're at.
So right now,
here.
Beth, you're going into it and you're
Oh,
showing
I'm
it
sorry.
actually real time.
Correct.
What the system looks like.
Right, so this is, and I'll have Melissa kind of walk through this, but to address your question, I will show you what that screen looks like for analytics. Let's see.
This is called the client side that you're looking at right here. So this is what managers and supervisors would see
Yeah.
from this side.
I don't want to confuse you with the so many different things that we have. So in here you can see, you know, our terminations, new hires, your department total. You can see here company overtime. You can drill down into any of these. I don't want to get too far into the weeds with it. Your application step. And these are just the things that I kind of keep track of. So again, here, your salary expenses per month. So you can kind of see where you're at. And of course, you know, it's going to fluctuate as, you know, your needs or your demands within your departments. But I mean, it's pretty extensive. So that's kind of what that looks like. It's there's a lot of data.
The reporting capability is actually quite amazing.
It's pretty amazing.
It looks amazing. I love all the data. I'm just like numbers person, so I just like want to dig in there.
This sounds like it's your jam. So, but yeah, that's just kind of, as you build your system, this is the type of information and the type of data that you're going to get. So it's a quick, you know, quick link and a quick overview, and you can get an idea of where you're at. So it's an awesome overview. But does that answer your kind of your question without drilling too far
My
into?
wheels are always turning. Go ahead.
You can pull reports based on payroll, based on quarter, based on the year, basically whatever time period you want to put in there. If you want to pull the last 5 years and almost on any topic.
I guess I just kind of look, it looks like, you know, pretty powerful. The question I have is, who's the big users of it, and do they use it? Do you think they use it in your county to, you know, make decisions that are, you know, because the purports is really should be able to drive your decision if you're hiring, not hiring, budgeting, if you have, like, you know, the chart, how many days a position is open, what are you doing what do you do with the data then? You push it to a manager and say, you're failing? Or
No.
we need to work on something, or you're over budget, or.
Right. So that's just one of the components that we use, that we look at. You know, when we have vacancies, or if there's a desire for a new position, we take all of that information. That's just one component, right? So state mandates are, you never know what you're going to get. And so we utilize that information to kind of drive whether or not there is a need, right? So you have, I'll use an example of a case aid social workers. Their caseloads, and for us, I guess, are super high. And so for them, if they have room in their budget, people come and go. And so you kind of see a little bit of cost savings. You can kind of keep an eye on your budget and whether or not, if you bring somebody on, what that's going to mean. And if your client's caseload is so high where you're burning out your social workers or your caseworkers, you can kind of, you know, project where you're going to be when, But of course, there's so many different factors that go into that, you know, as far as benefits, negotiated rate of pay, you know, start date, those types of things. So it's just one small portion. It's part of a bigger conversation, but it can help give, you know, our administrator an overview of where financially that place is sitting. But I would always say IFS is the true, tried and true, because that's going to contain everything as far as the department's budget as a whole, the overview. This really will drill down into, you know, an individual employee's position and, you know, what they personally elect, you know, for benefits and rate of pay. So you can see it overall, but I think when it comes to creating new positions, I mean, that's outside of my realm as far as budget, budget goes. So it's a key component.
To go back to your original question though, who uses Paycom? Everybody in the county. Employees use it on a probably daily, for sure weekly, bi-weekly basis when they're entering in their time cards, verifying their accruals, changing any benefits, checking on their benefits, accessing any of their benefit documents. We can build in links to all of their benefit documents. Us in administration, we are logged in every day, all day long. That's where we manage the majority of our system. So.
And you can see here on the right, the direct data exchange, there's 99.7 employee usage. This refreshes every pay period. You can, so there's exceptions for us for FMLA. We as administrators go in and adjust those time cards. And so that's why you're not seeing, you'll rarely see it ever at 100%. But we have some exceptions. So that's pretty high rate of usage, so. And again, on this last slide are just pros and cons that we kind of just talked about. And then if you're interested in seeing the more of what the employee sees, we can walk you through that if you want to see what it looks like for a manager or department head on the client side. We can definitely walk through that, but want to be respectful of your time and address any questions that you have. And we could ramble all day about Paycom.
I just think it's so awesome that Melissa and Beth are here, because I think at the last work session, we got the whole big picture, everything thrown at you, seeing the whole, you know, software. And I think what it drills down to, and after we talked to the other counties, and I've got feedback from the other 2 counties that are using it, we found that there are 3 counties in Minnesota currently using it, and we know of 3 counties right now that are in talks with considering it along with ourselves. But it comes down to where we need a system where employees can enter their start time and their end time every day, and then it automatically calculates the pay, the differentials, the overtime. We also want a system where employees can log in themselves. They can change their own withholding. They can add dependents, adjust their benefits, look at their records, giving them the control over their payroll details, and finally, the ability to look at that paycheck before it goes into their account and look at it and make sure it's accurate so that they can reach up and say something's not right or it needs to be corrected. It kind of puts all that control in the employee's hands, and that's kind of what I would really wish for Todd County employees. And I mean, is that what it's done for Morrison County employees, would you say?
Yep,
Okay.
absolutely.
Do you know, you give an employee the opportunity to change their debt withholdings and these things? Do they call you too and say, hey, did that go through?
No, they can actually see it all on their own, and I will have you drive if you want to.
Or do they call you and say, what should I do here? Like they just don't know?
Kind of both. It depends on the employee.
Right.
I would say more often they are managing it on their own and we don't hear from them, but there is definitely a handful of people that will still call and want to be walked through.
Maybe it's just a one-time call. Once they understand it, then they do it, right?
Right.
Yes, you'll have to click the button again once
You want to lock back in, right?
Yeah. Here, let's use this one.
So we're going to take a look and see, this is what Beth sees from an employee perspective.
Just kidding. Security purposes.
Wadena County had shared that they're very happy with Paycom. They said it's user-friendly. They have been now working on the HR side, and they really like the streamlining, and they enjoy the representative is always available to them. So they're very appreciative and enjoy Paycom. And then I also have something from Redwood.
Yeah.
In front of you here is what an employee would see when they log into Paycom. Oh, blanking out for a second here. And the mobile app looks almost exactly identical, except for the tiles are basically stacked on top of each other.
Ta-da.
There we go.
Getting better at your guys' technology than I am back at home in Morrison.
So pretty simple. Here's where you would add your hours, do time off requests. I'm gonna just show you what an add hours screen looks like. Beth's is a little bit different because she doesn't work in a 24-hour role. So it's just adding the hours that she worked, and then down at the bottom here, as an employee, you can see the calculations of what that looks like for your pay so far, and as your week builds and you add your hours, you would be able to see everything there. You can see from admin, we'll be able to see who has signed the timesheets. We want to always see, the state auditors are going to require you to show an employee signature, and then also the supervisor's signatures. From her add hour screen, she can also see any time off that she has accrued. You can build out all different types of accrual types. Part-time staff will see different. If you click back just on the upper right-hand corner, your logo, it'll bring you back to the home screen. Same screen here under the time off requests. This is how you would put in your time off requests. You can do this at home, you can do this from your work computer. Click your day. If you want to show the others' requests, that'll show in your office or in your work group who else has time off. So maybe if you should avoid the day.
So, Mr. Chair, I got a question.
Yeah.
So if there's no fudging on the time that you enter, you can't fudge it?
No.
Okay.
No, I mean, it's
Hours worked are hours worked.
hours worked are hours worked. You manage your own information. So this would be any of your HR information, your address, contact information. You also can have your job description built out so you can see that in real time. One thing we built out this last year that I like a lot is called Total Rewards. This has been kind of an advantage for people that are leaving or thinking about leaving Morrison County. They can look in here, if yours loads, and they can see in kind of a snapshot how much Morrison County actually, the total compensation package is, not just your hourly rate of pay. It includes just a little detailed description of all of the benefits on the second page. And then, it doesn't let me scroll, huh? If I zoom out just a little bit. There we go. And then the total compensation all the way to the bottom of the screen. So the value of your time off.
No, it doesn't make it bigger.
But the total compensation would include all of the county paid benefits as well.
Are you personally logging in and off every day?
Say that again?
Are you personally logging in and out every day?
To my employee side, I probably log in once a week and put in my time.
Uh-huh.
But to the client side, the manager side, every single day.
Does it tell you where you logged on from?
I believe you could set that.
Right, so there's a.
Like if you logged on from your home computer versus a mobile device versus an office?
Right. I'm pretty sure that that's a capability of the system. I don't think that we have that activated currently.
Correct, yeah, so I think.
Like Jackie Bauer calls me and says, I'm working from home today, Bob.
Right.
Okay.
That is a
And
feature
then
that
she's
they
in, you know,
Hawaii.
yeah. And she's
That
getting
sounds
her-
amazing.
And she's getting her nails done in Alexandria. What?
Here, where's she at?
So that is a feature that Paycom
Got
does
an odd
offer.
mind.
The geofencing, I think is what they call it. That is not something that we utilize. Yep, within Morrison County. But right, yeah, it is a feature. We looked at it, we considered it when we implemented, but at the time, I think it was just too much change because we were implementing so many modules, that it was just something that we didn't want to spend time on at the time. We were more concerned about payroll and applications and such, but that is a component that they do offer.
Commissioner Rogers, just to let you know, Elliot is on. You just can't see it because she's click shared in. And he's been shaking his head yes to
Yes.
your, I don't know if
Who
that's
is our
right, Elliot.
salesperson?
Elliot Kane from Paycom is on. You just can't see because they're
Elliot, I
using-
hope we're doing
Oh, he's
you
commenting
justice.
on it?
Well, he's just listening in and I can see him.
Oh, you
And
can?
he's been
Oh,
shaking his
gotcha, yeah.
head, yes. And I
Hello.
did ask him. Oh, there he is.
He's here. Yeah, there he is.
There he is. Perfect, in the clouds.
In the cloud.
So I don't know much about it, but yeah.
That's fine, I'm good.
Mhm.
Thank you.
You're welcome.
One other nice feature is checklists, and we utilize this a lot during benefit enrollments. You can build out steps employees need to take to complete their benefit enrollments. First step, it'll usually include some type of a video that Beth usually ends up building, and then links to all of our benefit managers, and they'll have their own separate.
What was your HR department head count before you started this?
1, 2, 3, 4,
6-ish.
for HR.
For just HR. It's
Just HR.
Been 3. Well, Matt, 4.
And what is it now?
Same.
That's 4 with the county administrator, right?
Correct.
Right. Mm-hmm. Yeah, he serves as our HR director. I'm just the manager. Then we have a HR specialist and Melissa's our payroll specialist, so.
Documents are what we're currently building out. It's mostly built out, and I think most of the county is on that right now. Employees can also manage their documents from this site, so if different positions require different types of certifications, trying to think of what else we use it for.
Training, cell phone, telework.
So like all your policies.
Yeah.
They can see essentially their entire employee file.
Yeah. Yeah.
Yep. And then as we build out performance, you'd be able to see all of your past performance reviews as well. Learning, I know Beth touched on that briefly. Paycom has a whole bunch of pre-built learning already in there. So if you're ever having a discipline issue with an employee or a new supervisor to a position and you want to assign them some supervisor training, maybe on just system management, or even how to manage an employee that's out on FMLA, all of that is pre-built in the system. So it's not something HR has to build out anymore. It's been really nice. Personal action forms is how you change things in payroll. So every change that the administration makes to any employee's forms, like a pay change, they would see it here. It would all be listed out within their personal action forms.
So in the event, if we're on a step and grade, so if, when they get their next step, they can go in and see when that was applied to what pay period. Make sure it coincides with their anniversary date that they received it at an appropriate time. Our longevity pays, of course, when they hit certain years of service, those are loaded in there. I'm trying to think of what else reimbursements. So now that we're using expense management, reimbursements for taxable meals, are created on the admin side, and employees can see those in there as well.
And then our new employee directory is also built out within Paycom, and then the org charts. And you can,
Org chart.
yep, you can click into basically any area of the county and it'll expand it all the way out.
So if you click on Matt, you can kind of see whom he supervises, and then you can kind of see in there that department's head count. So Nate Bertram, Health and Human Services, he's got
This is his
121, so this is his leadership, and then you can drill down to each one of those units.
There's office support.
Yeah, and this is our front office.
Who's your financial services manager? I'm just kidding.
Don't say anything.
I would never.
No, so, and then employee contact information is also in here. So, if you're looking for somebody specific, you type their name and then it pops up. So, real time, it's very helpful, not trying to keep spreadsheets or org charts standalone up to date, and it's helpful.
And then I'll just show you a quick look here. This is the manager side. So this is what managers will see. And you can customize everybody's view, so not everyone would have access to payroll. In Morrison County, it's myself and Beth. Not everyone would have access to talent acquisition. That would be all of the applicants coming in. Typically that in our county, it's mostly department heads. There's a handful of supervisors that also do some of the hiring.
Our hiring managers.
It's just a on-off button.
Yep,
Yeah.
you'll build out different types of permissions for each person.
Or
Radio
group.
button, we call them, whatever.
Mm-hmm.
So everyone's is just a little bit different. Beth sees all of it.
I see everything. I'm an admin, so this is the holy grail. Yeah, but which is, pros, cons, there's no sandbox to play in per se, to create or project or manage any type of future changes. It's all real time. And so what you see is what you have. So it does at times get a little tricky. I think, right now we're talking about how we're gonna allocate police aid, I think, is some grant monies that got floated down from the state. How are we gonna apply it within the system to make sure that we meet those parameters? And so that's conversations between our CFO and Paycom and what our systems can do, and trying to figure out what those are. So unfortunately, there's no way to apply it, to test it, to see it. So as long as you know what you've done and where you've been, and of course that audit trail has come in handy plenty of times. So it's a learning curve, but we've been on it for almost 4 years now, and I thoroughly enjoy it. It's going well for us. So, are there any other questions or anything that you guys would like to see more of?
Mr. Chair, if I may, just a question I have, when speaking to the employees, other than yourselves, do you see any complaints from them about the system? What don't they like about it? I'd like to know what you're hearing back,
Yeah,
the
so-
feedback you're getting from your employees.
I don't, so we tried really hard to keep it pretty similar to what we had,
Okay.
to what we built, right? So as far as putting their time, they had to learn a new system. So of course, change is hard. But now that they're in it, it's like second nature, right? So, in the beginning, we had really great groups of employees within each of those special areas, unique areas like our jail and the sheriff's, where we had to incorporate punches. There was corrections that needed to be made with payroll, and creating, excuse me, creating earning codes. For the most part, it's good. they appreciate the time off request. You know, filling out their time card is pretty much the same as it had been, just a different system. I don't know that we really get many.
I think that with any system switchover, there's frustrations.
Right.
And there definitely was frustrations, but they were very short-lived. And I think that after everybody understood how to navigate the systems, there's really been hardly any. I feel like our open enrollment process in years past have been like, Beth and I, we can't be off. We're working a ton of overtime. This is like kind of a stressful time of the year for us. And now we get almost no questions, because people have 100% access to everything. And throughout the year, they can have access to all of their plan forms through links, so they don't even have to ask. They
Yeah,
can
it does
find
look a
all
lot
on
to
their
me
phone.
like it's probably the time entering part of it that they would really deal with on a weekly basis is very similar to what we would have currently. So it wouldn't be a ton of a change other than a different platform.
Correct. I think that, I know you asked what the HR count had changed, or if it had changed at all, and I think it's just, it's a different process for HR. I think before we did a ton of hand-holding and walking people through systems and answering questions and whatnot. And now our job is just different in that our job is managing a system and building out the system, because it changes every single year. You know, rates of pay change, benefits change every single year. So it's just different work, but it's still the same. I did want to show you just one other thing really quick that is kind of nice. I just, I'm looking at one of our sheriff deputies' time cards here. And so I know I had showed you Beth's, but this is what like a sheriff's deputy time card would look like, somebody that works a 24-hour shift. They do a punch in with an hour and a punch out with an hour. Uh-oh, what's going on here?
We gotta click.
Okay. They can see, oopsie.
Oh, there, hey, ta-da. There you go. And then you gotta go back to it.
Okay. So they can see their total hours per day. So this would just be like a regular shift. Here is a shift. He must have come in and shifted his hours to just a little bit of a later shift, and then also worked some extra for someone else. So if you click or just kind of hover over the top of the allocation, it'll tell you what his pay type was. And he's got a comp time earned. He must have picked up somebody's shift. And then all the way down to the bottom here, where this is where it was showing the totals, the employee can see that he's correctly earning his shift diff for the correct amount of hours each pay period. He can see his comp time being allocated, the shift diff that he's earning here on his comp time. And then the comp time requested, it looks like he had some paid out too. He must have had some time off on here. Yep. And he's got a pending one too.
Military, is it military time there, Melissa? That's.
Yeah, because it's 24 hours.
Yep.
Yeah,
Oh,
it's 24 hours.
Okay, that's what they're doing anyway.
Yeah.
So all they do is put their end time in.
Yep.
And their start time,
And
and then Paycom just figures
the
it for
system
them. On
calculates
it?
all of the pays.
Yeah.
Right. So like this would be another administrative change and something that
Right.
HR would have to manage as contracts change, any of the pays that change.
Whereas right now, they're having to manually calculate their differential pay, and a lot of times there's no fault to them. It's sometimes wrong math, and they're shorting themselves hours.
Yeah.
Or forgetting to put in their differential pay period.
Right.
Right.
Yeah.
Right, we're manually computing it. That's the part I would like us to not be doing.
Right,
And then before he signs his timesheet, he knows what his paycheck's gonna be.
right.
Any questions or discussion for the team from Morrison County?
Yes, Mr. Chair. Ladies, I'd like to thank you for making a trip west.
Absolutely.
Educating us on this.
The snow has begun, so it's time for
Yeah,
you to
get
go.
back over there safe.
It's time for you to head back.
Greatly appreciated.
Yeah, well, thank you for having us. I mean, anything that we can do, you know, if this is something you decide to move forward with, absolutely, we're more than welcome to help out your team. We can talk through, you know, some of the things that we've experienced and what works for us. And, you know, I think we're pretty similar in a lot of ways, but yet we're also very different. So yeah, absolutely.
Yeah.
Resource for you. So thank you guys for inviting us and taking a peek at what we got.
Yeah. Have a good day. Thank you very much.
Thank you.
Safe
Have
travels.
a good day.
Commissioner
Okay, that
Byers,
would-
I'd like to just add, not for them,
Oh,
but
okay.
since I
Yeah,
wasn't
you
here at the
just-
last presentation,
go. Thank
I wanted to give the board a little history. We're with CPT now on a payroll system through them. I can tell you from my years here, we already looked back 10, 15 years ago under Carlin and Lesney when she was HR to change systems because there was many counties jumping ship because CPT wasn't giving us what we needed at that time. Now, because there's so many more jumping ship currently, because I hear this at all my meetings, CPT is saying, well, we'll rewrite it. Well, I'll tell you something, they've been doing the rewrite tax package, and Randy can testify, they've been rewriting that for over 10 years, and we still don't have it up and running. So I'm just letting you know some history on what we currently have, because I wasn't here at the last meeting, and I wanted to share that so the board would know.
Thank you. We're done.
So Elliot's on too here from Paycom.
Oh, yeah, sorry.
You know, we
Elliot,
know that with the programs we have right now that we cobble together to do our payroll and onboarding and benefits, we're still, you know, that comes up to about $32,000 is what we computed per year. Obviously, Paycom's going to cost more than that per year, so there's a gap there. I think Nellie and I have talked over, I mean, there's a possibility we could absorb that gap in administration. But I also think this is a really important investment. We haven't landed on a number with Paycom. We're in talks with that. And I guess we're kind of hoping we can move forward with making a decision, but I realize we need to get to a number. There's an implementation fee that's one time that begins. I believe that, I've talked to Sourcewell, that's a third-party consulting grant amount that we can apply for after July 1st. But the annual fee, that's what we'd be talking about. So I guess I'm looking to all of you to get your opinion on what you're thinking about Paycom. Is it something we keep going with, or are we at a crossroads, or what are we thinking?
Mr. Chair, if I may. I think the first thing we do need to see is the numbers, the hard numbers, like what are we getting rid of and what are we adding on? And then we can make a decision if we want to, you know, entertain moving forward based on financially, does it make sense? And I mean, in the end, we're spending taxpayer dollars here and we want to do the best we can for them, but we're also trying to make it the best we can for our employees as well. So, yeah, I like to see the hard numbers, maybe just a little touch at the next work session, give us the numbers of what we lose and what we gain, and
Okay.
come up with that, you know, and we can, I mean, that's just what I want to see. And 'cause I think I like the program. I think the concept of it's really good, combining everything into one rather than having to piece everything together and things not interacting with each other, taking a lot of that human error out of it it's a good thing. It's just, I mean, I like the opportunity to streamline things, make things easier, utilize technology. Everyone else is doing it. We shouldn't be behind. And you know, I mean, I like they said, they don't use the geofence. I don't like that idea either. I think just like we do it now, they plug it in their time. I mean, yeah, they can log in on their own device if they choose to, but they have the option to log in on their computer at work and exactly use their computer at work, put your time in every 2 weeks or whatever they need to do, and call it a day.
Yep.
I think we gotta know the cost. Of course,
Okay.
that's very important. I like a lot of the things they can do. I mean, the charts and whatnot that we can see. Some of the questions we had this morning for Jackie could have been pre-answered by just, you know, pushing a button and it would have been there in front of us. I think we need that part of it desperately right now. And sometimes you gotta spend a little money to save some money also, so. Yeah, I look forward to having more presentations and finding out what the actual cost is.
Mr. Chair, I think also that if we're gonna go for it, I'd like to get all the bells and whistles, okay? But it comes with a cost. We need to know what that cost is.
Yeah.
But for me, I like the graphs and stuff that was presented. I'm a graph person, so it explains a lot more to me than just throwing numbers out there, so I'm impressed with it. It's, again, goes back to, if we're gonna do it, let's get all the bells and whistles, but what's it gonna cost?
Okay.
I think, even tracking the overtime in departments, at what point is it more reasonable to hire another person on versus paying overtime? It's that,
Overtime's killed us.
yeah, it's that
And that would be a way
we're
to,
not having.
that we could use it to justify, yes, we need another position because you're paying out, 100,000 in overtime, whereas if you had another staff, their
Yeah,
wages and benefits would be less than that.
right.
Right, we'd have the data to analyze. So I'm hearing maybe get the numbers together
Yeah.
and try to come to our next work session if it works. I know our next one, we're gonna be pretty busy. We're going to have Senator Utke and Representative Weiner here. And so that work session may be a little full.
Yeah,
But maybe the
Jackie,
following.
would it work even if you could get that information and get it to personnel, and even if personnel can decide if we want to go to another work session or if it's time to bring it to the board, Because I take your opinion, once you get the data out.
Yeah.
Should we try for that? We can talk about it if that's the right
Yeah.
avenue, or for a May work session. Okay.
And now we get to see how sharp Paycom's pencil is, so we can see what they can offer us, right? Right, Elliot?
Absolutely, yeah.
There you go.
We want to make it work, absolutely. And I know we had briefly talked about this a few weeks back, and I know, Jack had mentioned it was coming in around that 78, 79K, and Jackie and Nellie have given us the feedback that is a little bit out of the ballpark, and so wanted to just, again, transparently get some feedback on, where you all would like to see that be, because again, then from there, we have to kind of bring it up the ladder to our regional vice president to, see those concessions be made on that proposal. So not sure if that's something we can discuss now, or if we want to take that offline and have those discussions at a later date.
I don't.
And
I think maybe that's a discussion you guys should have with personnel.
Yeah. Start there.
okay,
We'll
But
start that with our personnel
That's where I would
committee.
start it, is take it offline and do it with the personnel.
Sure.
And Denise, are you part of the personnel, or you should be within that? Yeah.
okay.
All right.
Okay.
That's great. We can let you know, Elliot, when that meeting is next. So thank you for hanging on with us. Today went a bit long, so appreciate that.
Thank you guys for your time. Have a good one.
Thank you.
Thanks,
All
Elliot.
right, thank you.
I thought it was an excellent presentation, that Morrison. I mean, when you can actually see what's in there and the charts and the different.
Is there any way we can
areas.
find out what the other counties are paying for Paycom?
We're already working.
That's
Okay,
what I figured.
I just want to know what they're paying. We can,
No, for us to do an open discussion, we don't know that part of it.
want to see what they're paying. What's Wadena County paying? Because they have less staff than we do, don't they?
We're done with work session, shut her off.